The most common types of illnesses that I'm seeing right now are upper respiratory infections like the common cold and sinusitis. A lot of these infections are caused by rhinoviruses, which are everywhere. You can get them from just touching a contaminated surface or from close personal contact with an infected person. The upper respiratory infections usually last around 5 to 10 days. They can last a little bit longer. Some of the symptoms of the upper respiratory infections include cough, runny nose, sore throat, congestion, sneezing. A sinusitis can have some of these same symptoms, but usually with a sinusitis you have a lot more facial pressure and fever. The common cold is usually not treated with antibiotics and can be treated with over-the-counter medications, whereas sometimes we'll use antibiotics for sinusitis. In my opinion, the most important way to keep from getting sick is to wash your hands or use hand sanitizer, and this is most important in people who are out in public places a lot, or around chronically ill people, or around school-aged children. When you do sneeze or cough, if you can do so into your elbow, that prevents you from reintroducing the viruses and bacteria that your body is trying to expel. As far as preventing the flu, it's highly recommended that people ages 6 months and older receive the flu vaccine. Another way to keep from getting sick is to not smoke. In my opinion, you're much more likely to come down with an upper respiratory infection or the flu if you're a smoker. Also, participating in regular exercise and eating a well-balanced diet and remaining well hydrated all contribute to a healthy immune system and keep you from, or help you fight off these infections. Also, I recommend you people get adequate sleep, because as your body is more rested, you're more likely to fight off these infections. First of all, kids get colds and there's really no way around that. It seems that some kids have a constant runny nose, but it is very important to teach your child to wash his or her hands after he's been playing with toys, after he goes to the restroom, after he sneezes or coughs. As I said before, making sure that your kid is well hydrated and has adequate sleep is very important. Sometimes I will recommend a vitamin supplement for some children. Another way to protect your child is to make sure they're up to date on all their immunizations, such as the flu vaccine. Well, the flu shot contains an inactivated form of the virus, or a dead virus, so it's not really possible to actually contract the actual flu from a flu shot. However, in some people, the flu shot can cause some flu-like symptoms like a runny nose, a low-grade fever, or general achiness as your body builds up an immune response to the flu vaccine. However, these symptoms are usually pretty mild, and they go away within a few days, and they're pretty rare. It takes about 2 weeks for your body to produce an immune response to the flu vaccine, but as far as how long that protects you from the flu, there's really no consensus on that. It is true that antibody levels wane in the months following the vaccine, but there's been no true studies that compare the vaccine effectiveness according to the month in which it was given. However, because of that waning effect and because of the change in the flu virus from year to year, it's recommended that you get the flu vaccine on a yearly basis. I would say that the symptoms will last anywhere from 5 to 7 days, but you may actually have a dry cough for several days after that. But you may run a fever for anywhere from 5 to 7 days if you're not treated. So.